Is lockdown an effective means of dealing with the coronavirus outbreak? By Matthew Plant and Mnqobi Kumalo. I have been reading the news recently during April, and especially during this lockdown period, as I've had more time. I saw stories relating to Sweden and how they haven't had much restriction to their everyday lives. This made me think of their neighboring country, Denmark, and if their idea of lockdown is working, and if it's a better and more effective way of dealing with the coronavirus.
What inspired my partner and I was, and still is, the situation that we are currently in as a country and as the world regarding the virus. When Matthew and I heard we were going into lockdown, we were both unsure as to whether this was the best way for the government to tackle the issue. So we decided to investigate the rationale behind the president's decision to do so and how effective it would prove to be.
The coronavirus is a newly found disease that started in Wuhan, China. It has been declared a pandemic. We have seen many countries take the approach of lockdown. However, there is no vaccine for this virus, so the best way to stay safe is to social distance, learn about the disease, and to sanitize.
This project will help people better understand the reasoning behind the decision to go into lockdown and how successfully the spread of the virus would be hindered due to the implementation of lockdown.
The aim for this investigation is to determine, by analyzing the statistical data available, whether or not the tactic of lockdown is an effective way of dealing with the coronavirus outbreak. The hypothesis for this investigation is that lockdown is an effective and plausible strategy for handling the coronavirus.
We decided to use the following statistics to evaluate the effectiveness of lockdown and herd immunity. They include total cases, active cases, and recovery and death rates. We decided to use these stats as they give an accurate depiction of the scenarios, while also being simple and easy to interpret. The trends of both of the countries' graphs were similar, with both graphs peaking and declining around the same times. The difference between the graphs of Denmark and Sweden were the values, and how high and low they peaked and declined.
Based on the research we have done and the results that we have seen, we can conclude that our hypothesis is correct. The statistical data is available to back this up. The lockdown also gained Denmark much time to prepare their healthcare systems, unlike Sweden, who did not have much time. What is very evident is that the Swedish have struggled to deal with the coronavirus, but this was much expected. Research could be conducted on the economic effects of lockdown on Denmark and how Denmark's economy had struggled. Same with Sweden, or how well it has done compared to Denmark, when the statistics are released. Another part of further research that could be conducted is researching the quality of facilities and how clean their public areas are, or how many people have been tested for the coronavirus. Surveys could be conducted within Denmark and Sweden and ask whether or not people disinfect their groceries and if they wear masks whenever they go out and interact with people outside of their households.
My group partner and I used a number of resources in order to find the information we needed to carry out this investigation. The sites and resources we used included WHO.com, TheVerge.com, BBC.com, WorldoMeter.com, TheNewYorkTimes.com, WeForum.org, and TheConversation.com.